program. Our first speaker today is Dr. Lauren Crawford. Dr. Crawford is a board-certified plastic surgeon who has practiced in Austin since 2010. She is the founder of Lady Docs of Austin, a Facebook-based networking group providing support and community building for over 1,000 female physicians in Travis County. She is active in TCMS in leadership roles with Women in Medicine and on the PWP Steering Committee, among other activities. As a mom, juggling a busy household and medical practice, Lauren has become increasingly interested in resources and strategies that can help the physician mom maintain sanity. Lauren, thanks so much for joining us today.
Thank you guys so much for having me. It's a great morning here. I have to apologize. I've never given a presentation this way, so I'm definitely a newbie at this. But I got a PowerPoint presentation together because I think it's great to see a visual along with the person speaking, especially in this format. And so I'm going to crack some jokes, and since I can't hear anybody, I'll probably periodically laugh at my own jokes. So here we go. So the physician mom is my topic of interest. Once again, I'm Dr. Lauren Crawford, a plastic surgeon here in Austin. So my qualifications for this talk are basically that I am indeed a physician and I do have 2 children. So I am what my title suggests. And like Dr. Sawyer said, I am the administrator of Lady Docs of Austin, which is a networking group here. So a little background how I became a physician mom. We try our best to have the best laid plans. We think we know what's going to happen with our future, and we are frequently wrong. With my first child, I just started practice here in Austin in 2010, and I was due at Thanksgiving. My instincts, or maybe lack of maternal instincts, made me think that I would go at least to Thanksgiving, if not before. And so I had these carefully crafted plans for slowing my operative schedule down in the 2 weeks before that due date. But of course, labor starts on Halloween, right? So we're nearly a month early, and baby boy arrives. And the concept of maternity leave for someone who's self-employed and who's spending money on overhead, whether or not she uses it, is kind of an interesting predicament, especially early on in your career. You have concern about losing the trust and referral sources of local doctors. And you've got that extra onus on you to earn income and to not basically let your practice go in the red. So it was a struggle. I said that I would take 2 weeks off. I didn't quite get there. So this is a picture of me riding home from the hospital with my son, who's a newborn. He did stay in the hospital for 4 days for a little jaundice treatment. And so one reason I look so dressed up is I had escaped the hospital that day. I had driven over to my clinic to see some follow-ups and a pre-op patient because I felt good. And my husband and my mom had it at the hospital. So yes, I think technically my maternity leave was 3 days. I did do a surgery the following week, and all of this is a story not to prove how tough I am, but to prove this debacle over, nobody's laying out a path for you sometimes, and you're kind of stumbling along, figuring it out as you go. And it may not always be the healthiest choices you're making for yourself. And so I kind of want to expose a little bit more of what physician moms are dealing with, especially in this unique career path. So the networking connection thing, it's important. Because of my experiences here in Austin and feeling kind of disconnected from local doctors, I really grew an interest even early on, just shortly after the birth of my son, and started getting more involved. But then in 2015, I just decided to create a group. It's easy. And it kind of grew into something larger than I thought it might even grow into. So I think we need, because of our busy lives, we need an easy way to access a social outlet. We need an easy way to get the advice that we need, whether it's housekeeping service or laundry service or a specialist actually to go to, learning about our referral sources and what their niches really are, who treats migraines. And so when you can log on and have a responsive group, because that's critical, obviously, you can get these answers in almost real time, within minutes. And it's just so nice to have that convenience. And yes, there's support. We've had physician moms in our community dealing with a lot, from a sick child to a cancer diagnosis. And it's nice to feel that people are gathering around you, that you've got words of support, sometimes more tangible means of support in terms of even dinners being delivered to your house or flowers coming to your office when you open it. And news, it's sort of another news connection from trusted sources, not just literally every Facebook friend that you have, but people have logged on just to get updates on where you can get a rapid test, you know, in the city of Austin for COVID, where to send their patients, because some of that information is not provided quickly enough. And so it's nice to have your hand on the pulse of what's happening in the community. And friendship. I think sometimes networking is seen as inauthentic and not really true to forming up real relationships, but I've seen true friendships develop from this forum. So I was working on some of these slides on Monday, and my daughter was hanging around me, and she does not let me get work done very readily. She wanted to draw. She wanted to create some art, which is her thing. And so I sat down with her, and I'd been looking for a photo of sort of this mythic superpower, you know, superhero mom physician. And I really couldn't find exactly what I was looking for. So I drew one myself with her advice. And so I think it's a good emblematic symbol of this idea that we can have it all, that we're super powerful, that we can have excellence in all things. And it's sort of a myth of this consistent work-life balance. And I honestly don't think work-life balance is consistent. I think you can do things to keep you in a more sane balance most of the time, but patients and their health, it's an unpredictable thing, right? Things happen in clinic that you can't predict. Things happen in the operating room. Patients don't heal the way you expect. And so there's no way you can control literally the process of every day. So some days I feel like this drawing, you know, I've got my, instead of lasso of truth, I've got my stethoscope of strength, I guess. And I feel like I've got it all handled. And those are great days. Patients are happy with me. Clinic moved along like a dream. Everyone in my work environment was getting along. I got lunch, you know, my operations were going smoothly for the week. And you go home and you help your kid out with something with school, and you have a great dinner and the weather's perfect. And those kinds of days, you feel like this. Wow, I've got it under control. I've got it all. I've got this power. But it can quickly move to the struggle. So there's a lot of struggle in being a female physician. Once again, I could not find an image of kind of what I was shooting for, but this is sort of me with much better hair. And but this is sort of a drawing of one of my situations where I was operating and pumping between cases sometimes. And at one of my facilities, there were only shared bathrooms. There wasn't a female locker room. It was a small facility. And the only place I could go and pump was a storage closet. And there were boxes stacked around me. There was a metal chair. I'd steal a blanket from the operating room. And it was cold and unwelcoming and uncomfortable. And there was no lock on the door. And so I would just sit in there hoping no one needed anything from the closet and that I would be at peace for those few minutes. And the time thing, you know, you're sitting in there trying to concentrate, trying to relax and let this happen. But you know, you only have 20 to 25 minutes or you're going to delay the next case. And so that's on your brain more than anything else. And that's inclusive of everything. That's setup, takedown, getting your milk to a refrigerator. You've got that 20, 25 minutes and that's all you have. And so it's not a pleasant part of the experience. And I think some women know in all forms of business and industry that this exists for them. And they like it acknowledged. They like speaking to this experience. It's a battle to fit it all in. It's a battle to care for your baby, your family, your patients, yourself. You have this busy normal just as a doctor, and then you're going on to having sleep deprivation and pumping, breastfeeding, coordinating care, getting text messages from your nanny about what to do with this and what her rash is doing. It is true, and this is not a dig at my fellow physician dads who are killing it, doing a lot. There's always exceptions, and but I think most of the science that is out there, most of the research that's out there still agrees that more of the domestic workload falls to the female, even if income and job hours are accounted for. There is a statistic out there that within 6 years of starting practice, 30% of females have reduced their hours as opposed to about 5% of men. And in the specialty procedurally oriented fields, there is a statistic that shows that with more domestic burden, you have a greater chance of losing that specialist totally, like a complete career change. So it's a multitasking madhouse. On the left, you've got all the things that go along with being a physician. You've got the workload, EMR, patient records, call, patient emergencies, your administration roles, your meetings, CME, career upkeep. That's a lot. But then on the right side, you've got the physician mom stuff. You've got the nanny management, groceries and meal plans, cooking, house upkeep, kid activities of, you know, which of the organization of that alone is a fairly large burden, actually. And then school, feeling like you're on top of what's happening with your kids' education or actually making it to a Christmas party at school. And then any kind of family plans, whether that's vacations, experiences, family birthday parties, to planning for retirement. I mean, all of that is still there too, and part of what you're dealing with on a weekly or monthly basis. So what's wrong with all of this? There's the fatigue factor. There's isolation, which I think is a really toxic part of our profession. Honestly, you take people who were largely team players and learning in a team-oriented environment in medical school and even residency. And now we're all sort of frequently kind of lone wolves. I mean, even people who are in group practice may not see their partners all week. There's the system burdens of pre-authorizations and difficult reimbursement and medical record keeping. There's the culture that doesn't really support time off, and that looks at things like maternity leave as relative weaknesses. And that's still fairly pervasive. And then poor working relationships. I think because of the busy, stressful environment, everyone is affected by that, from front desk staff, reception, to our nurses, to our physician assistants. And it's hard to cultivate a good working relationship amongst all the burdens. It's hard to stop and be able to speak to people in the ways that would really cultivate a good working relationship. And that weighs heavy on women. If you have enough conversations, if you hear enough conversations, that weighs so much heavier on women than it does on men in general. And the lack of flexibility, we've got such constraints on our jobs sometimes. Some of the types of shift works I see for people in which there's no flexibility built in, that it's, you know, seemingly impossible to spend 20 minutes out of school to join in on a kid's party there. That there are so little ways of building in the flexibility that you need. And then that we ignore our needs in large part. And then we have associated guilt when we don't feel like the superwoman, when we can't do all of these things we wish to do. And it's that failure. So do we lean in or dive in, or do we get pushed in? I think medicine is really unique in that the swimming pool analogy works, because once we dive into patient care for the day, actually some of this multitasking stuff goes out the window because we do not have time. It's so focused devotion that we so infrequently come up for air. And so is there really a choice? I mean, if you're an ethical physician, how much of your day can you really spend to focus on career advancement? I mean, you are just drowning in patient care. So this idea that you can be consistently working towards something else is pretty tough, pretty hard to make happen. And we are guilty of moving our own goalposts of success. You know, we've got these shifting definitions of success. We've got things that are very clear as goals early on: grades, medical school, residency, maybe academics, your job. And those are all fairly clear cut. And then we get into a later portion of our lives and career, and then it's challenging sometimes, and you're comparing yourself to others. What grabs the priority now? What's your new success? Is it going to be income, assets, travel, prestige, some degree of fame? Job plus, meaning what are you adding on to your job to create more for yourself? And is that really what you originally intended to be your success story? So where to now? I think sometimes we do need to dig in and be consistent for ourselves in terms of what we think our success should be. I liked this photo because those are the kind of goalposts that I'd like to see in my life. So maternal discrimination is also a piece of this, the so-called maternal wall, which is relevant for higher earners and lower earners in our society, that women are viewed as less valuable because we have this weakness of getting pregnant and caring for kids. There's lots of assumptions. People assume a lot about a woman when she's pregnant, this assumption of leave, this assumption that there's going to be difficulties associated with it. They don't talk, they don't ask questions. There's a bias that sidelines a career sometimes. People don't get offered promotion, and sometimes it's not an extraordinarily negative take on the female, but it's just a sideline assumption that, oh, she wouldn't want to be part of this committee this year. She just had a baby like 6 months ago. But that's assumed and not actually asked. It affects business even when self-employed. So I've been on the receiving end of this. After I had my first child, and once again, I was back pretty quickly. And I felt like I made that clear. I had one referral source stop sending patients to me, and we actually thought we had angered that office or mistreated a patient in some way. And so I reached out, and it turns out they couldn't remember when I had my child, and they assumed that I might still be on leave. And this was 6 months after the birth of my son. And so, so women are guilty of this too. I've done it before. I've listened to a conversation talking about different candidates for a job, and somebody said something about, oh, well, so-and-so has 2 pretty young kids, so I don't know if she's up for that. And I'm almost nodding along, and then I have to kind of break myself out of the spell and say, wait, have you asked her? She seems like she's full-time. Maybe she's up for this new role too. And this is me back at my office with my firstborn. Kind of going on, there's other ways that this kind of shows up and creates stress and hardship is maternity leave makeup. I mean, even if you are unpaid, sometimes there's this sense by an organization that once the female physician is back, she needs to do extra work to kind of make up for that time off as if it was a vacation. The lack of pumping support, child health absence issues, when a kid's sick at school, what happens there, exclusion from meetings and decisions, being passed over for leadership roles. It's interesting, sometimes people report higher expectations and sometimes lower. So the higher is in this situation of you took leave, now you need to make up, you need to prove your commitment. So you need to work harder than everybody else because you need to prove that you're really here for this organization or this hospital or this practice, and actually more is expected of you as you come back. Versus lower expectations, people assuming you don't have the time or desire to take on your work. Quick changes in contract, and I would really advise anyone who's pregnant or recently who's recently had a child and who is presented with a change in contract, almost without request from you, not at your will. Always, always, always have a lawyer, have an employment lawyer review that contract. There's always something fishy about changes in contract around those times, and it's bitten a lot of people in the butt over the years. Being paid less than a less qualified doctor. Nothing will make a woman more angry than finding out that a less qualified younger male physician is brought on board and is paid more handsomely than she is. So if you want a female physician to lose all of her loyalty to a practice, that's a great move to do that. She'll be looking for a job the next day. Directly questioning the ability to be both a doctor and a mother. And I certainly think that, now that I'm 10 years in, that it's completely possible to do both and do both really well. Like I said, some days are going to be better for your family than others. So what to do? Early communication when you're pregnant, communicating and starting a negotiation of sorts about what your leave is going to look like, what your breastfeeding or pumping accommodations are going to look like. People don't communicate enough, I fear. Plan your leave, problem solve for your return. You can't ever start looking early enough for the child care solutions. And if you've got family in the area, that can be a lifesaver. Ask for the flexibility you need and see where that conversation can go. Call your referral sources and let them know exactly how long you're going to be out. And if you're not a woman or a mom, be an advocate, be a male advocate on the side of women advocating for what they need. For employers, administration, hospital systems, you're going to have to deal with it. Over 50% of physicians will be female. I mean, it's already the case in medical schools, and at least 80% of us will have kids. So these issues are not going to disappear So a culture change needs to happen, and it's already started, about accepting these things and looking at it from a more positive angle, better family accommodation policies, reasonable leave. There is some evidence that having really long leave policies, even though that sounds so great, can actually backfire with more maternal discrimination. So I think they do need to be reasonable. And a recent example of how the culture of America might even be changing is, you guys may be well aware, but in 2019, a big, fairly bipartisan legislation was passed. That's where we got our Space Force. But there, built into that package was also maternity and paternity leave for federal employees, and that leave is generally 3 months. Mentorship and strategy to keep moms on path. So when you're dealing with all these burdens and you do not see anyone above you that looks like you, that has the same challenges you do, I think it can be really hard to assume that you can be the trailblazer. And so I think pairing women up with mentors that can help them think through these paths and get them through those bumps in the road can be huge. And then the system and wellness. Wellness activities differ by person. So I think all of us want more time, flexibility, respect. Wellness systems to be really valid need money and leadership from the top. Mandatory activity can add burden. Sometimes people literally, like this woman, she looks so happy to be sleeping. People just need a nap, and they don't want to be told that they need to do an online wellness survey. They don't want to have to go to a mandatory meeting or be given one option, which might be, a yoga class. They want to be able to declare what they need for wellness. And have we eliminated Press Ganey yet? Improve the workplace tangibly and enhance the patient-doctor experience as best you can. I always think wellness is making life easier and better. Find that supportive partner. It doesn't have to be a husband. Invest in great childcare. Find those helpers in your community who you can lean on in times of urgency. Do not overschedule yourself. And you need to quash perfectionism because it just adds more burden. And reconsider your mom guilt. Your kids are going to be fine if they get extra screen time this week. Keep that peer group. Keep texting your friends. Keep engaging, because even if you're an introvert, you still need those outlets. And set work boundaries. If you were supposed to leave at 5 o'clock and that's not happening, there needs to be methods. There needs to be change to make it happen. And, get a dog if you need a dog, right? Wellness is often at its best, in my opinion, and some people may not agree, when it's very captivating, when it steals you away and quiets that constant buzz of our modern world. So for me, fishing, this summer, even building a sandcastle, my mind was locked on that. I didn't think about anything else except the beach and the weather and the sandcastle. And then in unexpected ways, even doing work, but going on a mission trip and seeing the way medicine was really intended to be, feeling that teamwork is so powerful and is such a good feeling. And then outsource, don't do it all, do less, do much less. Women physicians seem to need permission to outsource, which I don't understand. So housekeeping, finding your kids' cutesy school stuff on Etsy, paying for landscaping, what you can afford to do, but find your priorities, the meal prepping, this is a birthday cake. I haven't made a birthday cake in years now. I outsource it. Grocery delivery. And invest in yourself, slow things down, be open to wellness in different forms, be authentic. Women really struggle when they feel like their surroundings and the way that they're behaving is not authentic. fine tune your workplace, continue to mold it. It doesn't always happen overnight. It can be a years long process. So if your place of employment or your self-employment situation is worth it, and you think it's sustainable, then keep working at fine tuning it and feed your relationships, because at the end of the day, it's the relationships that matter, and really give you your joy. Thank you so much. Thank you to TCMS Wellness and Chantel and Brian. Thank you so much for this opportunity and bringing people together for this.